Hi, I'm Dr. Darria Long-Gillespie, or Dr. Darria. I am SVP of Clinical Strategy here at Share Care Headquarters, and I'm also an emergency room doctor. And today we're doing another one of our Share Care Live, Dr. Darria Live episodes on Facebook Live. So we're answering your questions. So today we're going to be answering a few of our questions that were posted to our site in the past couple of days specifically for this event. They were on dry drowning, on repellent, toxic or not, what do you use right now, sunscreen, what's the safest way to keep your family safe, and also sun poisoning and some other health things to know about during the summer. We'll get to all of them, so stay with us and enjoy today's Dr. Darria Live, Share Care Live segment. So our first one, Melissa B. asked about dry drowning and what is this phenomenon? Well, Melissa, it's a really good question because if you look online and Google dry drowning online, many of you probably are going to do that right now, you get a lot of really scary stories. And it's very rare, but it can be deadly and you need to prevent really what's called secondary or delayed drowning. Now, just to back up, what does dry drowning mean? There's a lot of really weird terms online. The term dry drowning isn't even a medical term we use anymore. Wet drowning, dry drowning, secondary drowning. They all don't mean anything anymore, so just kind of take them out of your vocabulary. We're talking about a delayed phenomenon here. And that means that a child or adult is in the water and they end up inhaling just a very small amount of water, so small that they don't really initially have significant symptoms. They often will cough a lot or sputter a little bit, but they don't have initial symptoms, but they did inhale a small amount, not enough to cause immediate problems, but enough that it causes damage to the lining of the lungs that over the next few hours can cause the lungs to collapse and build up with fluid and lead to death. And that's what's so tough about delayed drowning, that when you read the stories, you hear of a family that the child was in the tub or in a pool and the parents said they just seemed to kind of get a little bit of water, but not a big deal. They were fine. They went to bed and they died in their sleep. It's terrifying stories. And I know that any of you who are listening are saying, okay, so you're telling me now that if my child even swallows a little bit of water, I need to take them to the ER? I know that sounds totally impossible, and how are you supposed to do that as a parent? And that's not what I'm saying. I want to allay a lot of the fears about delayed drowning, and I want to tell you what to look for. So let's back up a little bit and also talk about some statistics for drowning and why it's so important that we talk about this right now. Drowning is a leading cause of death in people under the age of 45 in the U.S. and one of the very leading causes for kids for the age of under 5. And kids from age 1 to 4, it's secondary only to motor vehicle accidents for the cause of death. Of course, drowning deaths are more common in the summer. 2/3 of them happen between May and August. And those of you like me who are living in the South, you got to pay attention because the numbers for drowning are even higher in the South. We see 2 peaks. Of course, the highest number of drownings occur more in boys, and we're going to get to that. But there are 2 peaks of death from drowning. One is kids under the age of 5. Now that often occurs in pools, tubs. 55% of kids under the age of 1 can drown in a tub. And even containers. 16% of children under the age of 1 that drown in a bucket. It sounds crazy. It doesn't take a lot of water for a child under the age of 1. Now that's one group. The second group of children that die from drowning are, if you think of it, are boys age 15 to 25 because they are doing stupid things at that age. When we're talking about rivers, lakes, and beaches, they're being really daredevil, and they're the second peak that we see in kids. So back to dry drowning. Let's talk about it and how to be sane about it so that every time your child gets in the pool, you're not petrified. In dry drowning doesn't mean your child swallows a little bit of water. If they drink it, it means they actually inhale it. So they're going to have some signs or symptoms. Often afterwards, your child may cough a lot or have a little bit of difficulty breathing. There may be some more subtle signs. Maybe they're just really tired. Now, if your child had an episode where they were in a body of water, they seemed to inhale some, they coughed a little bit, but afterwards seemed okay, but they're really tired afterwards, that's not usual. If they have more severe symptoms like blue lips or pale skin, or if they're just really kind of argumentative or aggressive, or if they're vomiting later. Of course, if they have any signs of respiratory symptoms, shortness of breath, if they are wheezing, if they seem to be using what we call their accessory muscles, meaning looking at their muscles above their clavicle or underneath their clavicle, if they're using that increased work of breathing, those are of course signs. So what do you do? If your child has any signs, such as coughing a lot just after they're getting out of the water, or that they seem to inhale, I want you to watch them. When you look at the anecdotes online, they'll show that children dying 48 hours later. That's really stretching it when you look at the evidence. One study looked at 75 children who died from delayed drowning and found that they all had symptoms and significant symptoms in the first 7 hours. So if you as a parent are worried about your child having an episode, you don't think it was bad enough, you need to go to the ER immediately, it is a good idea to watch them for those 7 hours and look for those symptoms that I just talked about. Of course, prevention, an ounce of prevention is worth a pound of cure. Remember when your children are anywhere near the water. If they're in a pool, even if they can swim, but especially if they're younger ages, make sure what they say is to keep them within 2 steps of arm's reach so you can immediately grab your child. Of course, teaching them to swim is a great idea. If your child is in a bathtub, remember what I said, 55% of children under the age of 1 drown in a bathtub. Of those that drown happen in a bathtub. So never, ever, ever leave them unattended. And I know that sounds really OCD, but in my own home, I had to go grab a towel out of the closet the other day. I take my daughter. I have seen the worst of the worst in the ER, so I picked up my daughter. She was wet, she was dripping. I became wet, the floor was wet. It's okay. Do these things and you will prevent your children from drowning or delayed drowning. Now our next question is from Debbie G. And she said, are there any special tips for people with diabetes during the summer? Debbie G, absolutely. Having diabetes is tough in the first place. You have to be a lot more vigilant than the rest of us about your blood sugar and overall health. And in the summer, you have to be even more so. Here's why and what you should do, because I don't want to ruin your summer. I want your summer to be good. So a couple of things. If you are on medications for high blood pressure or like beta blockers or diuretics, it's really important because these can increase the risk of problems in the heat. So be a little more careful about not getting overheated and not getting dehydrated. Remember, heat can cause your blood sugars to fluctuate even more, and dehydration from sweating can make that even worse. So it causes higher blood glucose because you're already dehydrated. That high blood glucose causes you to urinate even more, which causes you to be more dehydrated, which causes a vicious cycle and leads people to come into the ER, which is what I saw with my patients yesterday even. I saw a patient with this. So very important that even before you get that first bit of dehydration, that you stay well hydrated and avoid overheating. So what to do? Of course, keep well hydrated. Stick to things that are sugar-free. I like water, I like seltzer. Things that have a lot of artificial sweeteners can even kind of trick our brains into thinking that we are receiving sugar. So I like to try to avoid them as much as possible. I love in the summer a pitcher of water with some fresh fruit in it. Just chop up some fresh fruit, put that in there. It gives a little bit of a flavor, makes it less boring. I also like what my daughter calls fizzy water, or AKA sparkling water. Makes it seem a little bit more fun. You really don't need sports drinks unless you're out there running a marathon. Sports drinks can have a lot of sugar and make you even more dehydrated. Watch for signs of heat exhaustion. Stick to the AC if it's really hot out. Remember to check your finger sticks, those blood glucose, as often as you're told by your doctor, often 4 times a day or more, whatever they're telling you to do. And don't avoid physical activity just because it's hot. Keep doing it because that physical activity in any weather can lower your body's need for insulin. So don't avoid the physical activity, but pay attention to your sugars so you don't give yourself too much insulin or too little. And lastly, make sure that your insulin is staying cool. Even if you're going outside and getting hot yourself, getting out in the sun, your insulin cannot handle that. Store it in a cool, dry place. Your glove box, too hot, anywhere in your car, all of that. Freezer, too hot. So make sure that it stays nice and cool so it can be as effective as you need it to be, and you can stay healthy this summer. Okay, next question is that Jessica Yu wants to know, what kind of sunscreen do you recommend for a family with sensitive skin that is not toxic? Jessica, I have a daughter myself, and I really care about what I'm giving her to eat and drink and putting in her body and putting on it. so much more nowadays. So I'm glad you asked this. If you have really sensitive skin, one of the things I tell people is the best SPF really isn't SPF at all. It is all the other things you can do. So SPF protective clothing, I'm a huge fan of this. I bought my daughter, since kids are especially sensitive, she has SPF shirts. They have SPF or UPF, what they call it in clothing, about 50. So she can keep that on. It doesn't wear off. It's waterproof, of course, sweat-proof, all of those things. You can buy them pretty inexpensively. Just Google sunscreen clothing or sun protective clothing or UPF to find out. Remember, you can also schedule around the sun, early mornings, late in the evening, or late afternoon when the sun isn't at its highest peak or better times to be out. Bring or find shade when you can. That shade is itself going to lower the temperature, the ambient temperature, about 5 to 7 degrees, and you can feel it. It feels so much cooler, and you're going to prevent burns. And then, of course, pay attention to the UV index. Now, of course, especially important that we're talking about this for kids because early sunburns are the worst as far as risk factors for skin cancer and other problems late in life. So really important for children and those really sensitive skin that they have. Couple of things I want to talk about where to not believe the hype. Waterproof, sweatproof, SPF of 100. Don't buy into it. Don't let yourself have a high sense of security from this. Because a lot of these that have all these numbers to them, nothing is sweatproof or waterproof. It all wears off. It has to be reapplied at around 90 minutes. And that SPF of 100 only protects you a smidgen, literally 1 to 2% more than something that's SPF of 50. So you may have heard some studies that showed that people who wear sunscreen have more chances of burns and skin cancer. Crazy, right? So should we not wear sunscreen? No, that is not the point. The point is what I was talking about, that hype, because they found that people who wear sunscreen put it on once, forget about it the rest of the day, and think they can go out immune to the rays of the sun, and then they can be okay. So that's all to say, wear the sunscreen, wear the right stuff, but don't let it give you a false sense of security. Sunscreen is especially important too when you're getting it, that you're getting broad spectrum. There's UVA rays and UVB rays. So let's talk about what you want to have in your sunscreen. Like I mentioned, broad spectrum. A lot of sunscreens, that SPF is based on UVB, and that's the burn factor. But there's also UVA, that's what causes aging and what significantly contributes to skin cancer. But usually something can have an SPF of 50, but the UVA scale protection can actually be really low. And the US actually has very different standards and lower standards for UVA than they have in Europe. So if you go out with an SPF of 50 to 75, you may be able to think you can stay out there for a long time and you're not burning, but you're not protecting yourself well against UVA. So again, it's that false sense of security. So what do you find? How can you find something that's a really good mix? I love the EWG, or Environmental Working Group. They have some great information on this, and they talk about zinc oxide. So first of all, when you're saying what to buy for sunscreen, you want broad spectrum, and there are a bunch of different things that create broad spectrum. So number 2 is what ingredient. I like mineral-based. And so for ingredients, it is mineral-based, and my favorite is zinc oxide. It's also the Environmental Working Group's favorite because it's stable in sunlight, and it also provides a pretty good protection against UVA, and actually better protection against UVA than titanium dioxide, which is another good mineral, but zinc oxide is probably a little bit better. And it's definitely better for UVA protection than other chemical sunscreens that we're seeing. So remember, broad spectrum, then with the ingredient being zinc oxide, be one of my favorites. Like I mentioned, don't bother with SPF higher than 50 or above. A lot of it can make your skin more white, so you're not going to put on as much, so you're not putting on enough, or it may irritate your skin. So you can put it on, but don't give yourself that false sense of security either. And do all these things, remember, wear your shields, hats, all of the other things to protect yourself. So clothing, hats, seek shade, and when you do use sunscreen, go for broad spectrum. Something with the zinc oxide is going to be better protection. It's mineral, to be safer for your family, and what I use in my own. All right, our next question, we're going to get to more about bug repellents. You've heard me talk a lot about Zika. You're going to think I'm obsessed with it. I've been writing a ton about it, and that's because this is something we all need to be really talking about. So again, I'm Dr. Darria Long-Gillespie. We're here at Dr. Darria Live, Share Care Live event, and our weekly event answering your questions. So 2 different people asked the same question. Melinda L. and Chad T.K. both asked about non-toxic bug repellents and said, how can you keep mosquitoes from biting you without toxic repellent sprays? I hear you, because, I don't want to put toxic things onto my body or my child. And it seems like right now we have a choice. You can either put toxic repellents on your body, or you can have a Zika infection. Talk about a bad choice. In this case, especially for pregnant women or women trying to be pregnant, the risk of the damage to your child of microcephaly from that Zika infection absolutely outweighs the risk of the dangers from repellents. So I'm not saying that if you're pregnant, go douse yourself in repellents and douse them in DEET, but you can use them carefully and with very cautious application. You are going to be safer than risking getting exposed to Zika. So that's where I stand. I have a lot of questions. I'm going to be asking and talking more to people at the CDC and the Environmental Working Group, because I want to get more answers. I'm going to be sharing them with you. So please send us more of your questions that you have. So number 1, the Environmental Working Group has done some guides on what to do for if you're pregnant, as has the CDC. And they recommend using DEET of 20 to 30%. Now, DEET has a long time had stories of seizures and neurologic impairment, and it's been really maligned. But the safety profile is a lot safer than we've been led to think. Those neurological consequences can happen in about 1 in 100 million users. That said, it is still a chemical, so I want you to apply it carefully. We're going to get to that, but want to get through all the other repellents. There's also picaridin, 20%. That's a good option to use. And there's another one you'll see, IR 3535. It's not in as many things. It's usually in combo sunscreen and repellents, which you should not be using. Use a sunscreen and use a repellent. Don't use a combo. There are other things I get asked about a lot that the EWG and CDC have both said are less effective, and that's one like oil of lemon eucalyptus. Now, people say it's natural. Technically, yes, it is, but the way they make this for the repellent is that they take the natural oil and they distill it and refine it so that the active ingredient PMD is actually about up to 65% higher than it is occurring naturally. So it's a natural source, but they've really chemically enhanced it. In some studies, it's been shown as effective as low-dose DEET, but for not as long. Now, since it's natural to a certain extent, the FDA requires less safety testing, meaning it hasn't been substantially tested in kids under the age of 3, which is why we don't advocate for use in children under the age of 3, and it's not shown to be effective against the Aedes mosquito, the mosquito that carries Zika as much. Lastly, ones that really aren't as effective are essential oils and vitamin B1 patches. Now, some essential oils may work for a short period of time, but not as effective against the Aedes mosquito. And since they're classified as botanicals, the FDA doesn't require them to test to show for effectiveness at all, and not as much safety testing either. So again, the CDC and the EWG do not recommend them for mosquito-borne infections. So here's what to do. What I want you to do if you have children at home, if you're pregnant or thinking about being pregnant, or everybody. DEET is probably one of the better things we have, but use it sparingly. Stick to about 20 to 30% for adults, 10 to 20% for kids. Apply it sparingly and wash it off as soon as you come in. Don't sit around all day with that on your skin. I also try to use long sleeves, long pants, so that you only have very little amount of exposed skin to which you have to apply DEET. So again, using it when you have to, because it's one of our best sources of safety, but using it sparingly. Now remember, I'm going to be I'm going to do more research on this to get more answers for you. So send me your questions. As we learn, we will learn together, and I will share the answers with you. Again, this is Dr. Darria Long-Gillespie from Share Care for Share Care Live, signing off, and I'll talk to you next Tuesday.